Hi everyone, my name is Julieta Ramirez, and today I will be doing a mock autopsy demonstration using our fetal pig here. I'll also be talking about some of the common procedures forensic pathologists use when performing real autopsies. Alright, let's begin. Before we start the actual dissection, you want to make sure you have all the necessary materials and personal protective equipment, or PPE, for the dissection. You're going to need gloves, a lab coat, and goggles. Goggles aren't necessary, but you can use them if you like. You're also going to need a tray to hold your pig, either an absorption sheet or some paper towels, a scalpel and scissors, probes, forceps, rubber bands, along with a weighing scale and ruler. Now that we have our workspace ready to go, we can go ahead and take out our pig. We're going to begin by examining the external anatomy. During a real autopsy, a forensic pathologist needs to search for any visible abnormalities on the body. This could include cuts, scrapes, bruises, injection sites, or broken nails. Any of these details could provide important insight on what really happened to the decedent. On your pig, you're going to want to take note of any body hair, any unique markings, the mouth, nose, umbilical cord, tongue, and ears. Any findings should be reported in your autopsy report. Once you get to the posterior ventral side, we can determine the gender. Looking at our diagram, you'll see that a female will have a urogenital opening and labia. These structures will be located beneath the anus, forming a small projection known as the genital papilla. A male pig, on the other hand, will have a urogenital opening closer to the umbilical cord. Depending on how developed it is, it may have a small sac of skin beneath the anus as well, known as the scrotum. Otherwise, it'll simply be smooth. As we can see on our pig, we have a male. Moving on, now we're going to measure our pigs. A simple way to do this is by taking a piece of string and putting it from the tip of the nose along the curvature of the body and to the base of the tail. From this length, we can determine the age of the pig using the following chart. Mine was about 25 centimeters long, which means it's about 100 days old. In humans, when dealing with severely decomposed or skeletal remains, it's vital for forensic pathologists to have a background in human anthropology to determine age, sex, and race. The pelvis, for example, can be examined to determine gender. So in females, the pubic arc angle is normally around 90 degrees or more, while in males it's closer to 60 degrees. The position of the sacrum also differs. In males, it's tilted inwards, creating a heart-like shape, while in females, it's tilted out. The distance between the ilia varies too. In females, there's a wider gap, while in males, it's more narrow. Forensic pathologists can also determine age by looking at the long bones. When you're born, hematopoietic marrow is present throughout the entire skeleton. Over time, it hardens through ossification. It starts along the diaphysis and continues to the distal metaphysis and finally into the proximal metaphysis. Marrow conversion continues until about your mid-30s, when bone marrow distribution finally reaches adult state. So when we look at this chart, the amount of that soft bone marrow that's still left over is what forensic pathologists are trying to look for when determining age. Alright, now going back to our pig, we can prepare for the internal anatomy. Taking your rubber bands, you're going to tie them into chains as shown above. Each chain should go underneath the tray and attach to each leg. This is going to keep everything back during the dissection. Now that we have our pig held in place, ventral side up, we can make our first incision. The type of cut we're going to do is called a Y incision. To assist us in finding where we have to make a cut, we're going to feel for the space between the top of the shoulder and the corner of the jaw. We're going to cut from here diagonally down to the midline, and then around the umbilical cord. Your initial cut should be shallow, cutting only through the skin. After that initial incision, you can cut deeper through the muscle tissue. The next steps will depend on the gender of your pig. As shown in the diagram, if you have a female pig, you'll cut straight down from the umbilical cord and around the anus. If you have a male, you'll make 2 parallel cuts from the umbilical cord. Because I have a male pig, I'm doing those 2 parallel cuts coming from the sides of the umbilical cord circle. Now I'm just going back and deepening those initial cuts, digging into the deeper layers of muscle. Once you get to the abdominal area, make sure to not cut too deep or you might damage the underlying organs. Once you can start seeing the underlying bones, tease back the layers of skin and muscle to expose the ribcage. By swiftly cutting away at the tissues, it should easily peel back with the scalpel. Next, lift the V-shaped flap and pull it gently upwards. Use the tip of the scalpel to assist in lifting the flap. The thymus gland tissue should not be exposed. It is located on both sides of the trachea. If you can't see it, try cutting a little bit deeper, there might still be muscle on top. Tease away the thymus gland tissue to expose the thyroid gland and better see the trachea. Now that you've removed your first organ, make sure to measure and weigh it, and record that data into your autopsy report. During a real autopsy, this is a very common practice for forensic pathologists to detect any abnormalities in the organs. Moving on, you're going to peel the skin and tissue away from the midline incision. Use the scalpel or scissors to help clear away the fascia. Make a lateral incision on both sides of the body at the bottom of the rib cage. Repeat the same process with the abdominal cavity, being careful to not cut any of the underlying organs. Here we can see the umbilical vein exposed, coming out from under the liver. Cut that vein to fully expose the abdominal cavity. Also make 2 low lateral incisions to fully open up the space. Moving back up to the chest area, cut up each side of the rib cage to remove the chest plate. Try to stay as low to the chest cavity as you can, and be careful to not damage the lungs underneath. You may notice that the diaphragm is still attached at the bottom of the rib cage after cutting up both sides. Cut the diaphragm away now so the chest plate can be fully lifted. Now cut away the remaining connections of tissue and bone so you can lift the chest plate off. Be careful when going around the heart. The bones may be a little tough, but the scissors should get through it. Now that the chest plate is off, we can remove the organ block. To begin, make the initial incision at the top of the trachea, just below the larynx. Lift from the trachea and pull gently downward. Make sure you have included the esophagus lying posterior to the trachea. Use the tip of the scalpel to help remove the connective tissue that holds the organ block to the back of the body. Once you're approximately halfway down the body, go to the lowest point of the large intestine and make an incision. It might be embedded in some tissue, so just dig around a little bit to get it out. Proceed with removal of the organ block from the bottom by pulling gently upward. As you pull upward, note the kidneys in the posterior of the abdominal cavity. We'll be removing those later. Also, make sure to note the testes at the bottom. When trying to identify the penis, make sure to not confuse it with the remaining end of the large intestine we cut. To remove the kidneys, simply gently cut away at the connective tissue around them. Note to see if you can find the ureters, like here. The next step is to remove each organ individually from the organ block. Make sure to measure the length and mass of each organ and record it on the data table. Starting with the heart, cut away at the connective tissue and blood vessels attached to the lungs. Next, cut away the lungs from the rest of the organ block. Note how the right lung is larger than the left. Unlike humans, pigs have 4 lobes in their right lung and 3 lobes in their left. Now we're moving on to the liver. Since it has so many lobes, it might be a little difficult to get it all out in one piece, so don't worry if it breaks apart a little bit. However, make sure to not forget about the gallbladder. This is a small green pouch tucked away underneath the liver, which produces the bile. Here we can see the spleen attached to the stomach. To remove this organ, simply cut away the connective tissue present. Moving on to the stomach, along with the intestines, which we'll be examining closer up next, these play a very important role in real autopsies for determining time of death. For example, if it was known when the person last ate, a forensic pathologist could be able to estimate time of death based on the food present or absent throughout the digestive tract. So, if undigested stomach contents are present, that means that death occurred 0 to 2 hours after the last meal. If the stomach is empty, but food is found in the small intestine, then death occurred at least 4 to 6 hours after a meal. Lastly, if the small intestine is empty and wastes are found in the large intestine, then death probably occurred 12 or more hours after their last meal. Another method for determining time of death involves analyzing body temperature. This is not as straightforward as simply taking their temperature, however. Outside factors such as the surrounding environment, the size of the corpse, age, clothing, and illnesses the decedent may have had could affect the rate of temperature loss. Next is livor mortis, or the color of death. This deals with the pooling of blood in the parts of the body that are lowest to the ground, also known as lividity. Livor mortis begins 2 hours after death and becomes permanent after 8. If the skin is discolored but turns white when touched, lividity has not completed and the body has been dead between 2 and 6 hours. Another method is by examining rigor mortis, or the stiffness of death. It occurs in different stages, with it beginning at 2 hours after death, starting with the eyelids, face, and neck. Peak rigor is reached 12 hours after death, and loss of rigor gradually begins after 12 hours. No rigor is seen 36 hours after death. Outside factors can affect the rate of rigor mortis, such as ambient temperature and how much the individual was using their muscles prior to death. The onset of rigor mortis is actually faster after higher levels of movement due to the accumulation of lactic acid and lack of oxygen. Lastly, the presence of insects act as a critical clue for estimating the time of death of bodies that have been dead for longer periods of time. Since flies and other insects can rapidly discover a body and their development times are predictable, the time of death can be calculated by counting back the days from the state of development of any insects living on the corpse. Coming back to the organ block, now we'll be removing the pancreas. This organ is slightly embedded into the intestines, so you'll have to use a scraping motion to get it out. Finally, we've reached the intestine, our last part of the organ block. The top section, the part that connects to the stomach, is going to be the small intestine. This is the longest part of the intestines. The large intestine is the thicker band that goes around. Here we have all our organs laid out. So to recap, going right to left, we have the 2 thymus glands, the thyroid gland, the 2 lungs, with the right lung having 1 more lobe, the heart, the diaphragm, the liver, our gallbladder, which is located underneath there, the stomach, the spleen, the pancreas, our 2 kidneys, the intestines, and the testes. Now the dissection is complete. If this were a real autopsy, the forensic pathologist would take the organs, place them in bags, and put them back into the body, sewing it closed afterwards, similar to what's seen in the following picture. Make sure to properly dispose of your specimen, any paper towels, and your gloves. I hope this demonstration was helpful. Thanks for watching.